You're listening to Evergreen Media Network. I am Cindy Schwartz, and this is the Patient Partner Show. We're also a podcast on Spreaker and all of its platforms, so look us up on that as well. Jeannie Roller and I are talking about healthcare issues. You know, a lot of this stuff happened to us, Jeannie, which is how we got on the forefront of all of this. Sadly enough, we certainly didn't want that to happen, but it has happened, and we decided to start this podcast and start talking about some of these issues, try to help other listeners, other people find a different alternative way to deal with this as we deal with it ourselves as well. It's not like don't need health care our own selves, right, Jeannie? And we found alternative avenues, those kind of things. So today you brought up an unbelievable subject, and it's so scary. And it's in the forefront of the news all the time, and it affects basically every one of us if you've ever been in the healthcare system. And that is the attacks, the cyber attacks, the ransomware, the information that's getting leaked, that's getting hacked, that's gotten stolen. And so many of these doctors and doctors' offices and facilities have the computerized version of all these files. And so what do we do? The stuff's out there.
Well, it's not only that, Cindy, but it's AI. And last week with the CrowdStrike episode, AI was affected, and AI in healthcare is very big. AI, a lot of times you don't know it, but they record your office visits, and through AI, then that is inserted into your medical records.
Yeah.
AI can make medicine decisions. AI can make treatment decisions. So last week when CrowdStrike had the issue, a lot of these hospital systems were left not knowing what to do because they didn't do that stuff anymore manually. It was all computerized. So, treatment was delayed, medicine wasn't dispensed, and so on and so forth. Now with the ransomware, we've suffered through three pretty large episodes lately. There was the Change one through United Healthcare. There was the Ascension one, and there is the University of Michigan one. Now, the thing about ransomware is, it gets in there and it locks up all the records that it wants. They don't lock up each and every one, but they have access to them. And a lot of hospital systems, and I'm not saying that these three did not, but a lot of hospital systems don't want to spend the extra money to encrypt patient information because it costs a lot more money. So when these hackers get into this, whether it's ransomware or whether they're just hacking it just to get the information, they have access to virtually everything about your life. They have your name, your address, your birth date, your next of kin, your mother's maiden name, your driver's license. They have everything.
They do.
Everything about you is in one neat place.
Yep.
So that is scary. And also during these attacks, they had to go back to using pen and paper. And a lot of these people did not know how to use pen and paper.
Right.
I remember reading in the Ascension attack that they were diverting emergency care elsewhere, which, for someone needing emergency care, that could have meant the difference between life and death if they had to go farther.
Yeah.
Medicines in some of these breaches, because of them, medicines were being mixed up. Orders weren't getting posted. Delays were happening. So it brings just not only can your information be compromised, but if you're actually a patient needing services, your health care can be compromised. It's just some really scary stuff that goes on that people don't realize. And if your information is one of those that they say is breached,
right,
which you get maybe a monitoring for maybe a year or two. But the thing about it is, once that information is out there, it's out there forever. It just isn't for a year or two. It is forever.
Right. It never gets taken down. If it's out there, it's still out
there. So it is amazing that, the 1 or 2 years monitoring really doesn't help you. because, as I said, that information is out there. I remember reading, and we talked about this, Cindy, last year, about the breast cancer patients who had the pictures of their
Right.
nude bodies stolen, and then they were published. I mean, there's so much to these breaches that I don't know why hospital systems are not all of them encrypting this information, so that even if they hack into the system, the hackers can't get that information as easily.
Well, it almost sounds like it almost should be a law that it has to be, because of how many hacking things happen. It's prevalent. I mean, AT&T just had that huge hack. Yeah. Target's been hacked. I mean, two that I can remember off the top of my head. That's a lot of people you're talking about, millions of people.
Right.
I just don't know why, if you're saying that there's a way. I mean, they're always whoever they are, and why are you hacking people's stuff? I mean, this is just ridiculous. But they're always seemingly one step ahead or two steps ahead or whatever. So at least on our end, the people that are not doing this stuff should be able to have that kind of, at least a little bit more safety, if you will. It should be required, is what I'm trying to say. I told you on a couple of podcasts ago, or whatever, going to a new cardiologist, his records are all paper. There's nothing that's online, nothing in online. So you can still do it. You can still do it.
Right. But most of these hospital systems don't train their people.
Right. They don't.
They need to have an emergency plan where they actually rehearse what would happen if technology became unavailable. And usually these ransomware attacks for such big systems, they can take up to a month or more to get back to being able to use the systems, because you have to totally sanitize those systems.
I can hear people saying that it doesn't happen that often, so why should you be trained in those kind of things? And then the argument I can hear people saying, doctors, medical people, patients, or whatever, listeners, that they need to be online to share with one doctor to the other. I'm here to tell you, 3/4 of the time they don't share any of this stuff from one doctor to the other. I think you can agree with that, Jeannie. I mean, I go into different doctors' offices and they're like, well, where was that report? I never got that. I'm like, I give up anymore. Either you have to walk around with it, in your purse or wherever, all of your reports, and bring them to each doctor. So to me, that's a moot point. They're not even using that to transfer it to the next doctor. I don't care how many times you write down who your GP is or who your, whatever is. They're not sharing this information. But the hackers are sharing it, so maybe they should give it to the hackers to give it to the next doctor. I mean, I'm being a smart aleck here, but I mean, come on. So I don't know. I mean, I wouldn't know that. I would want to know each time I walked into an office if my stuff was securely encrypted. But how do we even ask that question? We can't even get other questions answered about patient rights and informed consent. So how are we going to find out if our stuff is securely encrypted? I mean, it's crazy. And you have to go and get care. You do have to go get care at some point in your life. You do. Maybe you don't, but I mean, I think you do.
But truthfully, Cindy, there is certain information that they don't need. They don't really need your social security number.
That's
they don't
for
really
billing.
Need it in most cases.
Yeah.
That's for billing.
It is for billing.
But for your health care, they don't need it. And especially if you're a Medicare patient, they do not need it.
Mm-hmm. You know what I do with that? I give them the last 4. That's it. I won't put my whole social security. And I've done it, so it's out there somewhere. But anymore, I just give them the last 4. That's it. I won't give them the whole number.
Yeah.
I've started doing that quite a few years ago. I'm just like, because of what you said, it's for billing. So if you don't pay, they can follow you or whatever. That's what a lot of that stuff is for, in my opinion. Mm-hmm. It's for the billing aspects of it. So it's mind-boggling. Jeannie, you want a couple of stitches? You want to do this? You want to do that? You got to, have yourself taken care of. Maybe you have an emergency situation. I mean, my goodness. Well, look at the stuff we're running into. It's just crazy. It's absolutely crazy, what we have to put up with. And now we got our stuff out there on, the black web and every other thing. Goodness gracious.
Yeah, and it's not, it's not a question of if a hospital system will get hacked anymore.
When. Yeah.
It's a question of when.
That's everyone.
It is happening.
It is.
Yeah.
On that note, that's a sad note, but stay listening to Evergreen Media Network.